Hi, I'm Michael Nelson with Naturopathic Specialists. Today is Friday, April 17th, and I'm joined again by Dr. Daniel Rubin. How are you, Dr. Rubin?
Hey, Michael, very good.
So today's topic that you thought was really important we talked about centers
Yes,
around comorbidities. Can you explain what that means?
absolutely. Comorbidity means when you have one diagnosis and then you have another. So a morbidity is basically a disease or a diagnosed health condition like cardiovascular disease or obesity or respiratory diagnoses. And when you have two, then they're comorbidities. Two or more, I should say.
Okay. And why is that important to think about comorbidities right now, given the situation that the whole world is going through?
Absolutely. So what's important is that this video and these comorbidities that we're going to talk about are a relationship to people who are diagnosed with COVID-19, the disease called by or caused by the novel coronavirus, who are hospitalized. This is really important. And we're talking about potentially avoiding hospitalization should you contract the virus and develop COVID-19 and symptoms. So the idea is that people in the hospital, you're more likely to be in the hospital as your age increases. It doesn't mean the younger you are, you're not going to go into the hospital. But data that was gotten through March 1st through the 28th, and it was published just late last week, demonstrated that exactly what I just said, and that people with certain comorbidities and at certain ages were more likely to be hospitalized. Now, that doesn't mean we're talking about what their hospital course looks like. We don't have that data. So that's why it's important. And this, Michael, we're going to talk about why this is a call to action and that people can start doing something about this now.
Okay, excellent. So some of those things, like you say, we can take action now. What kind
Yes.
of conditions are we talking about?
So diagnoses for comorbidities that are recognized in this data set include obesity, diabetes, cardiovascular disease, respiratory diagnoses, and hypertension. So the idea is that if you're 65 or over and there's a 95% chance that you have a comorbidity if you're in the hospital. What that means is that if you can reduce your comorbidity amount or the status of your comorbidity, there may be, and I use the word carefully, may be less of a chance of being hospitalized or having more severe symptoms. It's basically a naturopathic concept. We're talking about vitality. We're talking about the health of the individual, improving the physiology. I mean, the human body is meant to move. Not enough people exercise. We know that. Obesity is up. There's more junk food on the market. People aren't paying enough attention to their diet. And the time is now, right now, to act. This is a call to action to anybody who's listening who has been thinking about improving their diet or improving their exercise, getting more sleep, or trying to expand their lungs or stretching or whatever it is that you've been thinking about doing. Maybe it's stopping smoking. Maybe it's getting an air purifier to improve your indoor air. Maybe it's going outside because a lot of the air is cleared up in our country and it's beautiful out and spring is here and people can get out and exercise as long as they're taking care of their distancing requirements. So here's another stat too, that in the younger group that was analyzed, which are people 18 to 44 years old, who there was an 85% chance that if they were in the hospital that they had a comorbidity as well. But the number one comorbidity among that age group, obesity. These are young people who have the ability and the joints, meaning, maybe less arthritis, better lungs. They're younger. They can get out and exercise and look at their diet. There's so much information. This is this is what naturopathic medicine does. And if people are interested, we are a naturopathic specialists. We're engaged in telehealth, either telephonic or by HIPAA compliant video chat on medical platforms. We can help. If anybody has any questions, contact us. Our phone number is 480-990-1111. Our website is listenandcare.com. We're on Instagram, we're on Facebook. Visit us on the web. We have contact information there. If you're thinking about this, we can help you.
Excellent. So, how much of these things that you're talking about are things that are related to like lifestyle or diet or activity, movement, things that
Beautiful question. Beautiful question. All of them,
Mhm.
but not necessarily all of them for all people. There is sometimes a family predisposition or a genomic issue that may cause somebody to have more of a propensity towards these diagnoses: cardiovascular disease, respiratory issues, high blood pressure, obesity, diabetes. But these can be preventable.
Mm.
In most people, these are preventable through lifestyle, nutrition, care of the human frame, physiology, mind. It's all there, and it's straight naturopathic medicine. This is what we were trained to do. And this is not what you're going to find in general conventional medicine. It's just not part of the curriculum. Maybe little teeny bits are, but not like you're going to find in a naturopathic physician's office, because we are born and bred into this.
Mm. And it's not something necessarily, I mean, obviously, any steps someone's going to take to better their health, given the condition that many of us, my age group, was in there. And I know being overweight or those kind of things, that's me. And I should know better. I should do better. But getting into the situation that I got myself into, or anyone in this situation got themselves into, is it something where they should just WebMD it or Google it or go to Etsy and pick out some diets? Or is it something they really should maybe involve a doctor to get some guidance on?
Again, great question. Beautiful question. Absolutely. Seeking medical attention to picking out what diet may be best, what types of exercise may be best, if there's testing that needs to be done, and certain supplementation as somebody's getting going. I mean, basically what you're talking about is preventing harm while you're trying to do good. And that's the role of the naturopathic doctor. And you hit it on the nose. Great question.
Well, that's awesome. And I know, especially, like you said, naturopathic specialists, that's the clinic name. And that's really what you doctors are. And
Yeah.
your focus, Dr. Coates' focus, Dr. Alschuler's focus, is in naturopathic oncology. So that's a highly, highly advanced and highly intertwined, complex diagnosis with several comorbidity factors that you have to deal with on a daily basis. So I know if I had to deal with something, I would probably want to talk to an expert or a specialist. And that's what you are, correct?
Oh, we are, yes. All three of us are board certified naturopathic oncologists, and so we understand human physiology very intricately. But Dr. Darling and Dr. Smolinski, who are not naturopathic oncologists, but seasoned naturopathic physicians who have been seeing patients for decades, are also absolutely understanding of this. They understand human physiology, exercise, diet, sleep, mental emotional well-being, cognitive well-being, interpersonal relationships, the role of laughter, the role of deep breathing, all of that. It's naturopathic medicine.
Well, that's great. And you mentioned that what we're talking about right now, specifically around the situation with COVID-19 that we've found ourselves in, is the time to take action right now. But
Right.
a lot of those things that you're talking about, lifestyle modifications, behavioral modifications, actually changing health from making those, is it like a switch? You just flip it and you're healthy the next day, or does it take time?
I think we all know the question to that. The answer to that. It's a great question. No, the human body is a wonderful, intricate, amazing entity, and it's changeable, but it takes care. I mean, there are plenty of people out there who rehab cars, or they take care of their cars, their babies, so to speak, or maybe their bicycle or their motorcycle or their gun, or they take care of a pet or a child. And just like anything, if let's use a car, for example, let's say you get a car that's not well, the starter's blown, the ignition won't turn on, something's rusted, you know that just by deciding and just buying the parts that all of a sudden it's going to work. That doesn't happen like that. You got to install the parts. And you know what? While you're installing something like that, something else may come up. It's like that with the human body. And so it does take time. But you're not going to get anywhere unless somebody makes the decision to start. And there's no better time to start right now.
Excellent.
Than right now.
Right now. So you know where the number is? Dr. Rubin mentioned 480-990-1111, or our website, www.listenandcare.com. As a reminder, if you found this information useful, follow us on Facebook, YouTube, or Instagram, and you'll be notified the next time we make a post like this. Thank you so much, Dr. Rubin. Stay safe.
Bye, everybody.